Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I am happy to be back in the Sunflower House today. And joining us today on this special episode is Dr. Margaret Richards Frankel. Dr. Frankel is at the forefront of dental treatment modalities, and her patients describe her as very innovative, very thorough, tech-savvy, aesthetically focused, knowledgeable, and kind. And she always takes the time to walk patients through the diagnosis, the treatment options, shared decision-making, and making them experts and advocates in their own care. Now, I've known Dr. Richards for some time because we share a friend, Sylvia Morrison, who's going to be doing some guest podcasting on Speaking of Women's Health in the Sunflower House. And Dr. Margaret Richards Frankel is a second generation in her family to service people in Cleveland and Northeast Ohio with quality expert dental care. And her father, who I also know, Dr. Stephen Richards, transitioned his dental practice to his daughter over a decade ago. Dr. Frankel is the graduate of Case School of Dental Medicine, and she's the member of many dental associations and organizations, local and national. And she's passionate about continuing her education and getting active in the dental community. In fact, she was on a plane when I was desperately trying to reach her when my granddaughter, Artemis, jumped off a couch as a superhero and smashed in her baby teeth. And she was so great, she got right back to me and got me all connected with Dr. Rachel Rosen, who I hope to have on the podcast in the future. So welcome so much, Dr. Frankel. We're so excited to have you here as a guest on the Speaking of Women's Health podcast to talk about dental issues important for women and their families.
Dr. Thacker, thank you so much for having me. I'm so excited to speak on these topics today.
Well, tell us just a little bit about your personal self. I know you're married to a handsome physician and you have two great children. Tell us a little bit about you personally.
Absolutely. So, as you mentioned, my dad is now a retired dentist, and I took over his practice about a decade ago. In my free time, I am currently raising a family. I am married to a physician. He is an ENT, facial plastic surgeon here in Cleveland. He works both with university hospitals and he has a private practice. So the two of us together are very busy. But we have two beautiful children that take up most of our time. Our daughter, Scarlett, is 9. She is an avid ice skater. I know the time is passing so quickly.
It is.
Yeah. And our son, Teddy, is 6 and he loves to play tennis. And they are both very ready for school to end, to start enjoying their summers. But they keep us both really busy. And we spend a lot of time with family. I actually happen to be an ice skater myself and a ballet dancer. So
I didn't know that.
Yeah. I still spend time doing those extracurricular, so to speak, activities when I'm not working or with my family. So, yeah.
Well, good for you. So you really live our Speaking of Women's Health motto, be strong, be healthy, and be in charge. That is so exciting.
I love that motto.
A busy mom and dentist and involved in your community. So thanks so much for joining us.
My pleasure.
I wanted you to talk a little bit about, you educated me that it's TMD, temporomandibular disorders. And I have a lot of patients who previously would come and ask me, well, do you think my jaw pain or my teeth or my sleep problems are related to TMJ? So maybe just tell us a little bit about this and what we need to know about it.
Yeah, absolutely. So interestingly enough, the motto of my practice is, the name of the practice is Richards Frankel Dentistry, but the motto is dentistry designed for health and well-being. And the reason I bring that up is because the jaw joints, the TM joints, so people often will say, I have TMJ. Well, you do. You have two TM joints, TMJs. The disease of the joints is called TMD, temporal mandibular disorder. And the reason I bring it up as dentistry designed for health and well-being is because TMD, the dysfunction of the joints, is often intimately related to our sleep quality, okay? And we can actually see the breakdown of the joints in patients that have poor sleep quality, or at least the dysfunction of the joints and dysfunction of the myofascial muscles that help us move our joints when we don't have great sleep quality. And there is a link between TMD and sleep disordered breathing. And the reason I got so into this is because when I finished dental school and I started my continuing education journey, I went to a course on sleep apnea and its relationship to dentistry. How dentistry not only can help physicians diagnose sleep apnea, but often we as dentists can be the first to see signs of sleep apnea in the mouth, much before a patient may ever go to a physician saying that they feel certain physical attributes or things that happen when a patient has sleep apnea. Oftentimes dentists can catch signs in the mouth very early. And one of those happens to be TMD. So patients with muscle pain in the face or joint pain, what they think might be joint pain, or clicking and popping of the joints, limited opening, just waking up in the morning with morning headaches, or feeling tired all the time, feeling like they aren't getting good sleep quality, and oftentimes it's associated with pain in the face or frequent headaches. Well, these can all be signs of sleep apnea. And I went to this course and I thought, oh my gosh, this is me. And so I went down a huge rabbit hole trying to learn everything I could about sleep apnea within dentistry. And here we are today. So that's one of my passions. But oftentimes patients, especially women who actually have more general complaints of TMD, can be suffering from sleep disordered breathing.
Well, I know in my practice, that's one of the things that I regularly screen virtually all of my patients for, because so many midlife women that present feeling fatigued or with weight gain or just brain fog, not as mentally sharp. Many of them certainly have hormonal imbalance and maybe in perimenopause and menopause, but many of them also do have sleep apnea, disordered breathing, and other medical problems that need to be teased out from just assessing whether or not they need hormones. I got really interesting. I got so interested in the relationship with dental health and general health, because it just seems like there's just this artificial separation with dentistry and medical care. And certainly I trained at the Cleveland Clinic, a major heart institution, and there's so much cardiovascular research and studies going on. And, there can be heart infections and endocarditis and failed cardiac surgeries and inflammation if the dental health isn't correct. And then as I got into my specialized women's health field in osteoporosis, I actually did some research with periodontist, formerly from CASE, Dr. Alina Palomo, looking at osteoporosis and whether people were on treatment or not, and just their teeth and gums and the aesthetics of it too, which of course we women care about I always say skin and hair and our appearance, but that includes the teeth. That includes the teeth too. So I think that's interesting that you bring the health and the aesthetics and the beauty, and as well as just the wellness. And if you can't be well if you're not sleeping.
Absolutely. I think one very important thing that you mentioned, and what such a great service you're providing for your patient, is screening for sleep disordered breathing, because you brought up that as we age, as women age, our hormones change, right? And it's shown that progesterone is very protective against sleep apnea.
Yes. And
obviously that's one of the benefits to being a woman premenopausal is our progesterone levels, right? Mm-hmm. And so as we hit menopause, our progesterone levels change, correct?
drop. They are just non-existent. So I always say how men have so much more sleep apnea than women, but then women just start to catch right up at midlife when they run out of eggs and don't have any more progesterone. I mean, we use a lot of natural progesterone in menopausal hormone regimens, and some women do say that they sleep better. But tell us about the dental exam and how do you evaluate, looking at the mouth, the bite, the tongue?
Yeah, absolutely. So one thing I like to say is that form and function are intimately related. So when women or anyone comes in and they just say, I've noticed a lot of changes occurring in my mouth or in my teeth. They're not as white, they look worn. They come with an aesthetic concern, but oftentimes there's a functional aspect to this as well. And so if your teeth are wearing down, whether that be from tooth grinding or from acid, from reflux or even silent reflux, these are red flags that there's some sort of dysfunction going on in the body itself. So it's not just about oral health. There's an intimate relationship between overall health and oral health. And so I love to be able to rejuvenate smiles, give people their smile back, make them look healthy. But oftentimes we have to address the etiology of why. The why is everything breaking down? Is it related to, like I said, sleep disordered breathing and nighttime clenching and grinding, which is a red flag for sleep disordered breathing? Is it related to acid reflux from GERD, or is it related to silent reflux, which a lot of patients actually suffer from unknowing? And once we do an examination, we see wear on their teeth secondary to acid. And the next question I would have is, do you have sleep apnea, or what is your sleep quality like? Because oftentimes silent reflux can be intimately related to sleep disordered breathing. So trying to figure out the why are the teeth breaking down? Is it secondary to poor sleep quality and nighttime bruxism or reflux? Like I said, figuring out the why helps us to not only restore the teeth and make them look great again and make people look youthful, but also it helps preserve them for the long term and make patients healthier. So I do work with physicians often to try and help with diagnoses and treatment. And then I get to also do the type of dentistry I love to do, which is the aesthetic restorative dentistry. There's also, and there's an emerging field now within dentistry, which is actually dentistry specifically designed to help improve sleep disordered breathing. So treatment modalities that will move beyond just managing sleep apnea, but actually working to help reduce the measurement of sleep apnea, AHI, help people feel better and breathe better both day and night.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
And so does that involve affecting their bite? Does that involve getting them set up for night guards to pull their jaw forward so they don't slack and constrict their airway?
Sure. So yes to all of the above. Now, actually, research out of Stanford and the Stanford protocol for treatment of sleep apnea has changed over the past 5 years, and they have implemented dental options. And when I say that, I'm talking about surgical interventional options to help with sleep apnea. So sleep apnea within dentistry can run the gamut of treatment. Like you said, we can make an appliance, like a special type of night guard that will move the jaw forward to help a patient breathe better, but not everybody needs that. So within medicine and dentistry, we're looking to target the areas where patients may have obstruction. Now, dentists look at the airway every day. We look in the mouth. We look more or less at the nose as well to see how patients are breathing. But really, within the oral cavity, we can see a lot of the airway. And so some of these treatment modalities allow us to move the bones of the face to better support the soft tissue in the airway and make the airway more patent. So I'm working with orthodontists. I'm doing restorative dentistry to increase oral volume, to make more room for the tongue, which is a main site of airway obstruction in patients with sleep apnea. So we're doing a lot of different things specific to each patient to help them be able to breathe better. So I like to always say that the top jaw, the maxilla, is the floor of the nose. So if that top jaw is narrow, if you smile and you don't see many teeth, that often is a sign that, you know, the top jaw is narrow. That is the floor of the nose, and that often can mean that actually the upper airway could be narrow as well. And so there's a lot of treatment modalities we have now to help make the airway larger and to allow patients to breathe better. And actually that can even lead to making them healthier from a periodontal perspective, from a gum disease perspective, from a cavity rate perspective. Generally aesthetics improve and sleep apnea improves.
Oh, that is excellent, because I have a lot of patients who try nasal CPAP, and even though that's improved with nasal pillows and smaller devices, a lot of patients, you know, don't want that as a long-term option.
Correct. There is a pretty high rate. I think actually the Cleveland Clinic did a big study on CPAP failure rate, non-compliance rate, and it's a pretty high percentage of patients that fail CPAP. And especially, I mean, as a young woman who myself had sleep apnea and was treated through dental modalities, such as the type of dental orthodontic surgery I was alluding to before, which Stanford now has in their sleep treatment protocols. So I can understand how it might be difficult at a younger age to find that you might have to stay on a CPAP the rest of your life.
Yes.
And so I feel like what dentistry can offer patients in terms of improvement in sleep disordered breathing or sleep apnea and TMD, it's so important to work with our physicians to be able to give patients alternatives to CPAP.
Absolutely.
yeah.
So I'm sure that not all dentists do this in their practice. Do you think it's advisable for everybody with sleep disordered breathing, regardless of age, to specifically see a dentist that has this area of interest or expertise? And how can patients find that out or identify whether their dentist has that expertise?
Absolutely. So not every dentist does have this expertise, right? In medicine, doctors are becoming more subspecialized within even their own departments, right? We pick a specialty. So not every dentist does do this, but there are plenty of dentists around the country that do. Actually, the American Dental Association in 2017 released a statement saying that dentists do have a responsibility to screen for sleep disordered breathing.
Ah.
Yeah, so the American Dental Association has this blanket statement. So every dentist should be able to at least look for the signs for sleep disordered breathing in the mouth, just basic ones, like I said, tooth wear, tooth grinding, right, a big tongue, a long soft palate, basic identifiers that may put a patient at risk for sleep apnea. So every dentist is probably doing a basic screening. Hopefully, right? But to really specialize in being able to help patients with sleep apnea by treating them or working towards a resolution strategy, that's not everybody. Now, I think a simple phone call to certain practices or searches, web searches, will help patients find a dentist that is plugged into the community to help patients with sleep disordered breathing.
Is there any like
whether it be
national
with physicians too.
website, like women will contact me and they're living, in Alaska or another state and they can't come to Northeast Ohio, and I'll direct them to menopause.org because it has a list of people interested in menopause. Is there any national organization that will list people in the dental field that are interested in disordered sleep? And
so I think I'm looking it up now. So I would love for there to be an easy national database to go to. So the AAPMD, that is a place that we use, aapmd.org. That may be a place actually to look. And then also the AADSM, American Academy of Dental Sleep Medicine, does list dentists that treat sleep apnea with oral devices specifically.
Oh,
so
great. So
patients that are just looking for like a mandibular advancement device to help treat their sleep apnea, the American Academy of Dental Sleep Medicine is one place. But there's a whole breadth of options for patients that go beyond that today in dentistry, but that is one place a patient could go.
Could start with. So maybe we'll get that information and those links in our show note today.
Yeah, absolutely.
So talk about home hygiene and, why women or, people of all ages need to see their dentist and have a good working relationship with their dentist, just like they do with their physician.
Yeah, so I think one of the most important aspects to home health care is the management of your gum health or your periodontal health. And that actually directly impacts your overall health as well. So gum disease is a disease mediated by bad bacteria, okay? And the mouth is the start of the GI system, and the mouth is a very vascular place. And the bacteria in the mouth, there is both good and bad, and we want a balance of the good and a less bad bacteria. And so home hygiene helps us to manage that equilibrium. It helps us keep the good bacteria doing what it's supposed to do and keep the bad bacteria that causes gum disease and actually is linked to cardiovascular disease and can be related to pregnancy health, that bad bacteria. We want to keep that at bay. So home hygiene is very important, brushing and flossing to remove bacterial buildup and the byproducts of the bad bacteria that sit on the teeth that cause chronic inflammation. So visiting your dentist, it's just as important to do that as well, because we need to, assess and manage periodontal health, with the dentist. And also, if there is gum disease, we need to be able to treat it. And so trying to control bad bacteria in the mouth is very important to general body inflammation.
We'll be back after a quick break.
Have you ever experienced fitness failure? You set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
So one of the things that became, I think, very prominent during, this COVID pandemic is the importance of nasal and oropharyngeal hygiene, because of course with any respiratory illness, that's where these viruses come in, and in general, we don't see outbreaks in dental offices or ENT, and those physicians and dentists are up in people's grills, nose and mouth and throat like all day long.
Absolutely.
And so I got very, interested and focused and telling my patients, rinse your nose out, with saline twice a day, or Xlear, which is like a grape seed extract.
I love Xlear.
I
Yes.
do too. I get it on Amazon.
Yes.
And then gargling either with like a very dilute 1% providone iodine if no iodine allergies, or 1% hydrogen peroxide. And I know that certain mouthwashes that I think have CPC supposedly were anti-SARS. So I started doing that, at least twice a day. And then if I thought I had an exposure with a sick patient, or I thought I was getting a little scratchy throat, I escalated that. And I would always tell my patients, if you have an infection coming down, it starts there. You need to really clean out those areas. But I had a friend say to me, well, if you don't really have any symptoms and you're just brushing and flossing, is it really good to be gargling? And can you be disrupting the healthy microbiome in the mouth by using and cleaning too much? So I just wondered, what's the right balance? And what do you personally do, and your husband, as a dentist and ENT, in terms of protecting yourself against respiratory viruses?
Sure. So let me start to unpack that, because there's so many good talking points here. But one thing I want to mention that you touched on, right, is the connection between the nose and the mouth and that microbiome, right? So it impacts our overall health, okay? But nasal breathing is actually very important for the innate immune system, for our immune system, because it helps flush out, viruses or bad bacteria. And we do want to be able to have the nasal airway work at an optimum level, right? Mm-hmm. And nitric oxide, which the nose releases and helps with ventilation, perfusion, breathing, and actually the nose, not just with nitric oxide, but helps clean and kill bad bacteria. So it's very important to be able to breathe through our nose. If we are mouth breathing, we're actually going to get a proliferation of bad bacteria. So the bacteria that cause gum disease, they like a dry oral environment where saliva is not working to be protective. They can proliferate more quickly. And so being able to breathe through our nose is so important for our immune health. I also would tell you that this is an emerging area, but mouthwash, there are many different mouthwashes on the market, right? And another thing we know is that acid is really bad for the mouth, okay? Whether it comes from bringing it back, whether it comes from reflux, from GERD, or whether it comes from beverages that are very acidic, or mouthwashes, believe it or not. Some of them are caustic and happen to be acidic, and that's damaging to the oral environment, both from the balance of the oral microbiome, but also enamel, that white stuff on our teeth that makes our teeth so white and beautiful. It dissolves under acid attack. And so I, in my practice, have started to change my regimen as to what type of mouth rinses I recommend for patients. So the Listerines of the world that do kill bacteria, they definitely kill bad bacteria, but we're starting to wonder in some arenas how much good bacteria is damaged by mouth rinses like that. So in my personal practice, I've shifted the type of mouth rinses I recommend to my patients, specifically because I want the acid to target the bad bacteria, but I don't want it to be acidic. I don't want an acidic mouthwash. I want a more basic mouthwash. Actually, the Xlear that you talked about, that has xylitol in it. There are new mouthwashes on the market that have xylitol, which is a good antibacterial option. And so now we're starting to use different mouthwashes that are not acidic, that target bad bacteria, hopefully keep the good bacteria healthy in the microbiome. So
should women look for the ingredient as xylitol, or do they have pHs listed, or is there any general, brands, or is it just very person specific and you just have to see your dentist?
So I can talk about two brands that I like that are out on the market, and they do happen to list their pH. I'm not so sure that Listerine has on the bottle the pH. or, for example, chlorhexidine, which is another type of mouth rinse that's often prescribed to patients post-oral surgery. Those are both known to be acidic based off of litmus tests. I had a colleague who actually did a big test of many mouth rinses last week. And so known basic mouth rinses, one that I really like is called Nano Silver. You can get it on Amazon. It's designed by a dentist. It's supposed to target acid, which again contributes to your cavity rate and an imbalance in the oral microbiome. And it does happen to have xylitol, and it has something nano silver particles, which are also antimicrobial. So it takes a little bit of a different route from the traditional alcohol-based mouth rinses. I like Nano Silver. I like the brand Risewell, which actually uses hydroxyapatite, which is a remineralizing agent that is healthy to the teeth. So those are two brands that I like to use or recommend to my patients at this juncture. What I've seen in research, I like to offer those instead.
So we are talking to Dr. Margaret Richards Frankel. She is a dentist, and she runs her practice, Dentistry Designed for Health and Wellness. Do you have a website, Instagram, any places that our listeners from around the world can find you and your great information?
Yes, Dr. Thacker. So my website is richardsfrankeldentistry.com. And I am on Instagram, and you can find me on Instagram. My handle is Margot Frankel _DMD. And there's some good tips. There's some before and after pictures.
Oh, we love those.
So, yeah, you can absolutely follow me on Instagram, Margot Frankel _DMD.
Oh, that is just terrific. Any last parting words, anything just from a gender perspective in terms of things that women, besides the fact that, of course, we do like aesthetics, and that aesthetics and good dental health will lead to good sleep and less TMD. Are there any other specific women's issues? I know that you had talked about preterm birth, which I know has been on the rise, and it's something that young women really need to focus on.
Yeah, so I'm going to make a plug for for women especially, go see your dentist. Do not avoid having routine dental care, those routine checkups and hygiene visits, people call them cleanings, during pregnancy, when you're thinking about getting pregnant. As we're aging, it is so important not to ignore your dental health, because it's so intimately related to your overall health, whether it's from a screening perspective for certain diseases like sleep apnea or cardiovascular disease. The dentist can work closely with your physicians to help manage these diseases and make you healthier. I think at the base of it comes to reducing inflammation, because oral inflammation impacts overall health inflammation. You mentioned, Dr. Thacker, specifically preterm birth. Well, the bacterium that cause gum disease, some of those have the ability to cross the placental barrier, and actually are related to preterm birth. And so treatment of gum disease, this is shown in literature, treatment of gum disease or periodontal disease during pregnancy reduces the risk of adverse outcomes in babies. And actually, believe it or not, treatment of sleep disordered breathing in mothers to be in pregnant women is shown to reduce chronic disease in children that are born from mothers who are treated for sleep apnea. So there's such an intimate link between how we breathe, our inflammatory levels, our oral health, to our overall health. Well, whether we be women that are pregnant or even postmenopausal. So see your dentist. Your dentist has so many important aspects to treatment, for you as a woman.
Yeah, that is my standard question as part of my review of systems is the last time that you saw your dentist, at least twice a year, and, last eye exam. And then, of course, for our osteoporosis patients, if they're expecting any major dental work, implants, oral surgery, especially because of some of the osteoporosis medicines that I use to treat.
Absolutely.
I know that personally, I had my first two sons very close together with the pregnancies, breastfeeding. And after I had my second son, I had a slate of dental issues and need for root canals. And I always just wondered if it was all of those nutritional demands or if it was just, timing. But knock on wood, everything has been fine since then. But I was glad to get all that cleared up before then I had my third child.
Yeah, absolutely. There is some thought that the vitamins that your baby is taking may cause some deficiencies, in the teeth, but a lot of this has to do with our habits, our frequency of eating when we're pregnant, what we might be eating, how we're breathing when we're pregnant. So there's a lot of factors that come into play. Also, again, a lot of women have suffer from reflux when they're pregnant as well, and that acid is damaging to the oral environment, and it can really actually increase your cavity rate when you're pregnant. So seeing the dentist during pregnancy is very important. Now, another thing I wanted to mention is at our practice we take blood pressures on our patients at least annually. Just because it's a wonderful screening tool. You should be seeing your dentist twice a year. As a woman, it's so important to be screening for cardiovascular disease, heart disease, and taking your blood pressure is one simple way to do that. And that's one of the things we offer our patients, along with making sure that we're up to date on their medical histories and working with their physicians to keep patients at their optimum health. Well,
that is just so superb. Thank you so much, Dr. Margaret Richards Frankel, for joining us in the Sunflower House in Speaking of Women's Health. You've been listening to our Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker. And if you're interested in scheduling an appointment with Dr. Richards Frankel dentistry, you can call 440-442-4477, and in the show notes we're going to have her richardsfrankeldentistry.com website, and on Instagram she's at Margot Frankel _DMD. This has just been a wealth of information, and I hope we can have you back in the Sunflower House and have other dental experts. I wanted to touch in the future on pediatric dental emergencies, since I just recently went through that, and that was so stressful. And thank you so much for talking to me. And I talked to your dad. He was so wonderful that night. And my son and daughter-in-law were just so appreciative. And I think it just really underscores the importance. We don't want to have emergencies. We want prevention, and that's why you need to be seen regularly by your doctor and at least twice a year by your dentist as well, and have the whole team working together, but then have that backup in case that there is an emergency. So if you've enjoyed listening to this podcast, which we're also going to have on our Rumble channel, which is speakingofwomenshealth.com, and we'll have some video clips on our Facebook and Twitter and Instagram, you can go to speakingofwomenshealth.com and hit the donate button, because we are a nonprofit dedicated to empowering women and their families to be strong, be healthy, and be in charge. So thank you to all our listeners for tuning in to the Speaking of Women's Health podcast. And please be sure to join us again in the Sunflower House.